Sometimes rib pain shows up out of nowhere and it can feel sharp, deep, and unnerving. But if it's not a pulled muscle or a misaligned joint, what else could it be? Hi, I'm Alexis Weidland, osteopath and co-founder of BlossomingMe and Healthy Learning Lounge. And today we're diving into inflammation-based rib pain. What causes it, what it feels like, and 3 simple ways that you can support your healing at home. Let's start with costochondritis, a common inflammatory condition where the cartilage connecting your ribs to your sternum becomes irritated and overloaded. You typically feel a sharp, stabbing or hot pain in the front of your chest, often close to the sternum. Pain that worsens when you breathe deeply, cough, or press the area. Discomfort that flares up with repetitive movements like lifting or twisting or overhead work. It's not uncommon for this to occur after an illness, especially where there's been persistent coughing, or when the rib cage and upper chest have been overused and sensitized. Stress and poor posture also play a role by reducing thoracic mobility and increasing tension throughout the upper chest and accessory breathing muscles. The pain often makes people feel anxious because it feels like it could be coming from the heart. And that's why it's so important to rule out cardiac or serious organ causes. If the pain feels deep, unrelenting, or doesn't change with movement, once you've confirmed it's musculoskeletal or inflammatory, then the real healing can begin. Other types of rib inflammation includes intercostal inflammation from muscle overuse or again from post-illness, posterior rib joint inflammation, especially after lifting, impact, or poor sleeping posture. Now here's the key. Rest isn't enough. The goal is to reduce the inflammation and to restore movement of the whole rib cage in order to prevent chronic pain cycles. So here are 3 gentle and effective strategies that you can try at home now. Using a warm compress or a heat pack in the area of discomfort. That can be at the front or at the back, wherever you're feeling most uncomfortable. Lie comfortably and just allow your body to rest with this heat supporting your muscles to relax and allowing a little bit of mobility to come back. Thoracic decompression using a rolled up towel. If you roll up a towel so that it's about this long and as thick as you like, you place it lengthways along your spine between your shoulder blades and you're lying flat on your back. You can support your head with a pillow if needed, and you can have your knees up to support your lower back. Then you can lay your arms out nice and wide and just rest there for a few minutes, possibly even up to 10. This allows movement through your thoracic spine and relaxing of the muscles of the rib cage at the back. It supports your nervous system to relax, and you can lie here and focus on some gentle, deep breathing. And thirdly, a gentle breathwork nervous system reset. Sitting or lying in a comfortable position, preferably somewhere where there's absolutely no pain. And you can do this with a heat pack if you'd like. Close your eyes, relax, and practice deep breathing. In for the count of 4, hold for the count of 4, and out for the count of 4. If you can slowly increase the length of your exhale as well, this helps to lower cortisol levels and increases vagal tone and reduces the sympathetic overdrive that fuels chronic inflammation and pain sensitivity. If your pain comes on suddenly without clear physical cause and doesn't change with posture or position, it's really important to rule out heart and other organ involvement. And if you're at all concerned, especially if it's affecting your breathing, seek immediate medical support. Those 3 techniques I discussed are not aggressive, but they can be powerful. They work by bringing your body out of the fight-flight stress response pattern and creating a condition that is needed for healing and repair. If you've had rib pain that just keeps flaring up, especially after stress or illness or poor posture positions, these inflammatory patterns could be a missing link. And that's exactly what we address inside the RibCage Reset mini course, with guided breath work, targeted mobility, and myofascial focused release tools. I walk you through each step to help your rib cage move better and hurt less. If you're interested, click the link below. And let's help your body to calm down and come back into balance.
So that's it for today. Did it raise any questions or aha moments? If so, I'd love to hear them, so please put those in the comments section. I love answering questions. I hope you found today useful. And if you know someone who could use this information, please share it. Remember to comment, like, and subscribe. Until next time, and in health, bye for now.